Ray Lynch here. We're at D1 Orlando. We're going to have some help of some doctors in physical therapy today. We're going to start a series covering the 5 main lifts: squat, bench, deadlift, clean and jerk, and the snatch. We're going to be going over each point right here. Here's your map. Get ready to learn. We are starting with the squat. Proper form on the squat, you want to make sure 3 biggest things you want to make sure you got. You got a neutral spine, put the weight in your heels, a slight push back in the hips when you start. From there, it's pretty much straight up and down. Let's take a look. What you guys are going to notice is that his hips are pushing back. He's not overarching his lumbar, but his hips are pushing back and he's keeping the weight in his heels. His chest is staying high and his elbows are under the bar. It's perfect form right here. Let's go over some common mistakes of the squat. First mistake, people will come straight down. Watch the knees. It's very, very hard on the patellar tendon, okay? Your first point on the squat is to push the hips back, almost like you're starting a good morning, and make sure the glutes are active, okay? Here's your first mistake. Second mistake, watch the lumbar spine. Pushing the hips back does not mean arc your back out. Push your hips out simply means push your hips out. Do not change your lumbar. From there, it's a straight up and down movement. Third mistake you'll see, people will line up with their toes square and try to come straight down like this. That is very, very hard on the knees. You want to externally rotate the femur slightly. That will help with glute activation and keeping the glutes on when you're squatting. Push the knees out, send the hips back, straight up and down from there. Those are the 3 biggest common mistakes in the squat.
Hey guys, I'm Dr. Lenny Jo Yarkin with SST Rehab at D1. So when a patient or an athlete comes to me, the first thing that I need to do is a musculoskeletal examination. I have to figure out what is lacking, what might be overcompensating, what is tight, what is weak, or is it just a motor control issue where your body can do what it needs to do but doesn't fire up the right muscles at the right time. So from a mobility perspective, there are so many different things that we can do to stretch the capsule and stretch the surrounding musculature, but we're just going to focus on 3 today. So Ray's going to give you a good demonstration of a soleus stretch. So he's going to throw one leg back, he's going to plant that heel to the ground, bend that back leg, and stretch really deep into the heel cord, like so. The stretch that Ray is going to perform is a groin stretch or an adductor stretch. They're the muscles that line the inner part of the thigh. So you're going to go into a side lunge position, you're going to turn the toes out slightly, and as you lean down to one side, you should feel a stretch along the inner thigh of the leg that is straight. In order for you to properly externally rotate those knees at the bottom of a squat, your adductors need good mobility. The last stretch that we're going to focus on today is a piriformis or a glute stretch. There's a lot of different ways to perform this stretch. Ray is going to show you in a weight-bearing position because that's most functional for a squat. So you stand next to something that you can grab onto. You're going to pull one leg over the other, ankle to knee, and you're going to slowly drop down into a squat. Sit your hips back. You should immediately feel a stretch in the glutes on the side that is up. And you hang out there, allow the hip to open up and the glutes to stretch out. There are so many things that we can do to activate the core muscles, which include the glutes, but we're going to save that for an upcoming video. For now, let's just focus on one corrective exercise that Ray is going to demonstrate. It's a corrective lunge. So you're going to split your stance, you're going to stand tall, you're going to engage the core by sucking the belly button in towards your spine. You're going to do a little posterior pelvic tilt. You're going to activate the glutes on the back side. You're going to keep that activation and keep the core tight here and then slowly lower. And as you lower, you should feel a pretty big stretch in the hip flexors of the back leg. Keep the core, keep the glutes, keep it, keep it, keep it, and then slowly come on up. Don't lose that. Before you do your squats, you're going to do about 5 on each leg, and then of course you can strengthen in this position with a different exercise prescription. Side effects of improper squat form may include the following: non-specific back pain, thoracic disc bulge, lumbar disc bulge, disc herniations, muscle strain, spinal stress fractures, facet joint arthropathy, sacroiliac joint dysfunction, hip pain, femoroacetabular impingement, labral tears, hamstring strain, knee pain, and many more. If you or a family member are suffering from any of these adverse effects, please contact your coach or physical therapist.